Hi, in this video we'd like to talk about the methods for HPV infection diagnosis. So as we all know, HPV is a common cause for cancers such as cervical cancers, cancers of the anal region, your esophagus cancer, head, neck cancers, and other forms of cancers within the sexual reproductive system. Now, diagnosis is very key because we want to catch it before it develops into cancer. At any stage before carcinoma, here at Antai Hospital, we can have it treated effectively without it developing into cancer where it will spread very aggressively. And then at that stage, you might need to consider chemotherapy to actually treat carcinoma. So detection is very key. And how we detect cervical cancer or even HPV infection is through a common diagnostic test known as Pap Smear. Pap Smear is commonly done for women only, but for men, we will do another test which is also very similar. We will simply collect cells of the affected region and then check for the DNA analysis for any presence of these HPV. So for women, it's most commonly found to be growing in the neck of the cervix, which means it's found directly at the top of the vaginal canal. That's very commonly the spot where we collect some abnormal cells. This is also where we can see if there's any abnormal changes of the surface of the cervix. This is where we can detect whether or not you are just a normal, harmless HPV infection, or are you in CIN1, CIN2, CIN3, or pre-carcinoma, or even cervical cancer. So it is recommended that women who are sexually active within the age of 20 to 55, and you are recommended to do it every 3 years. But those who are in their high-risk group, we can do it every 1 year. So once we collect these abnormal cells, once we do analysis in the lab, we can immediately let you know is there any HPV infection there? Is there any cause to be worried? If you are actually diagnosed to be infected with a HPV, here at Antai Hospital, we can immediately offer you a highly effective treatment to treat your HPV infection and stop it from developing any further. We want to kill it at the root cause using our proprietary medication known as Antai, which is very effective in killing all these abnormal cells that are infected, stimulates the region's immune system, and also replenishes healthy cells so that they don't come back again unless you get reinfected once more. So usually protocol here is that after diagnosis, you receive treatment with us, and then we will also recommend you to get vaccinated as well. Get your HPV vaccination is very important. Prevention is always better than cure. So if you'd like to find out more information or even interested about getting treatment with us with our HPV Antai highly effective treatment, you can visit our website, read some articles, and also contact us via the website. Leave me a comment down below as well.